Yes, your baby can develop a flat head too, unless you know the most obvious root cause that everyone is clearly missing and doing the correct basic thing that will avoid or remedy it. I will show you what you essentially need to know about flat head syndrome. Okay. I'm Dr. Chris MD, helping mums to be happy and raise healthy, happy babies. Now, as a family physician, I've delivered more than 1,000 babies like yours, and I've coached tens of thousands of mums just like you with their newborns. So what is plagiocephaly? This is the fancy medical word for flathead. Plagio is slanting and cephalo is head, so it's a slanting head, known plainly as flat head syndrome. So plagiocephaly is an uneven or asymmetrical head shape. A flat head means it's got a flattened spot on the back on the side of the baby's head. Yes, like I said, plagiocephaly, also sometimes called flathead syndrome, is when a baby develops a flat spot on the one side of the head or the back of the head. It happens during these first few months when their skulls are still soft, and some babies more soft than others, for a very good reason, but I'll get to that later, and make a whole video just about that for you also. It's life-saving stuff, this, for your baby. Then, added to that is your baby sleeps in the same position most of the time, as you've been coached by everyone to always put your baby back to sleep. And another thing is, because of problems with the neck muscles, it can also result in a head-turning preference. That's called torticollis. Torticollis means torted neck. So that can cause a flat spot from laying on the one side only all the time. So this must not be confused by misshaped heads of the newborn, whose skull is made up of 4 plates, separated by 2 sutures and 2 soft spots, which enable this miracle of nature where a huge baby gets delivered through a tiny vaginal passage, especially if this 1-hour process of popping out through the pelvis gets delayed to many, many hours. Mother or baby issues in the final stage of birth can cause this, and then there's extra pressure on the head. So a newborn's head is soft, and these 4 bony plates can fold over each other, make the head smaller and elongated so it can fit through the birth canal, very tight fit, and we call this casting. And the back of the head is then swollen, elongated, like a cone shape or a cone head, and we call it caput or molding, and this recovers within a few days after birth when baby looks all handsome and in shape again. So what contributes to this deformation called plagiocephaly? Well, lack of space and cramped upness in the womb causes the hair to squash, especially in the last third of pregnancy or last trimester. Now, back sleeping, laying flat on the back all the time, especially once a small flat spot is formed, then it's more comfortable to keep laying on exactly that spot and not otherwise cause pressure on the edge of the flat spot. So the baby prefers that position. Also, muscular torticollis due to tightening of one side of the neck muscles, causing the baby to lay comfortably only on one side and in the same position. Also prematurity, of course. Skull bones of the preemies are even softer, so these little guys often spend weeks in NICU, with neonatal intensive care units, and often strapped down flat on their backs on a ventilator in this one position. Well, that's kind of life-saving and a small price to pay, and we can fix it afterwards again. Now, dealing with this for many years in my practice, and especially how it is getting more and more prevalent, made me think about it, and I figured out what all these things have in common in our modern society. More about that later. Please subscribe and click like if you're getting value from this video. Then in the algorithm, YouTube will show to more people, and it's very important that they all know this. What are the symptoms? Well, mostly not noticeable at birth, but it may develop during the first few months of life. So a flat spot may then appear on one side of the head or the whole back of the head, and it enlarges as the baby grows, gets more flat. Okay, it is diagnosed by simple observation. Always believe grandma's observations, okay? If grandma says there's a flat spot, then go check it out well. And you can also feel this thing. You can feel it with your hands. And your health care provider can notice it during the regular baby checkups. So they often have less hair on that area also, because they're laying there all the time, kind of breaking this little baby hair. Now, when looking down at their head, it may seem like the one ear is flattened on the side, and it may look pushed forward. And in severe cases, the forehead on the opposite side may bulge and look a little uneven too. Okay, how is it treated? Now, that depends on the baby's symptoms, age, general health, and severity of the flat spot. To keep pressure off that flat spot, hold your baby more often in your arms and putting it down so much. Changing baby sleep positions in the positions in the crib to the opposite side, even when they are sleeping, to sneak them over. Maxing out on tummy time. Make sure to attend to torticollis if it's present, the skewness from the neck muscles. So physical therapy and the home exercise program usually are part of the treatment. Now, receiving physical therapy to promote symmetrical development. Okay, if it gets severe and beyond 6 months of age, your healthcare provider may recommend a custom-made, like an orthotic helmet with a hard outer shell and a foam lining inside. This is to direct your baby's remaining head growth into the areas needed for correction, and it's very effective. Now, on a good note, as babies grow and they develop, they will be more mobile and reposition themselves. This removes the pressure caused by this condition. Okay, but if the flat spot is moderate to severe, it may not get better on its own. If treatment is not started within early enough, then your child's head may continue to be uneven. So what else should I know? Well, a flat head syndrome improves with time and natural growth. And as babies grow, they begin to change position themselves during sleep so that their heads aren't always in the same position as before. Now, when babies can sit on their own, the flat spot usually won't get any worse. Then, over months and years, as the skull grows, the flattening will improve, even in severe cases. Now, as hair grows in and it covers over the first few years, the flat spot only becomes less noticeable as well and eventually disappears. So flat head syndrome doesn't affect the baby's brain growth or brain performance, but having a stiff neck can slow the early development. So it doesn't crawl, doesn't do things that it should, if the neck is stiff. So physical therapy for plagiocephaly should include a check of the baby's progress and extra exercises to treat any delays. Can it be prevented? This is where everybody focuses on tummy time and keeping baby off the flat spot and keep them upright basically, but there's something far more important than any of this. Check this out. Nobody considers the reason why the bone is denting in. Why are babies nowadays with soft skulls? And when I was a kid, there was no soft skulls really. Come see for yourself why this modern day sudden escalation of our babies with soft flat heads is definitely not caused by sleeping on their back, but merely a manifestation of something more profound, yet too obvious, that also affects other aspects of everyone's development and health in these modern times. Okay, it's almost like the whole of medicine is still believing in the earth is flat, pun intended. Watch my video, Flathead Missing Building Blocks. I'm going to make that one too. Come and look for yourself how it is not what you do, but what you don't do that has dire consequences in many aspects of your baby's life. The key solution is to prevent it and to resolve it. It's simple and it's cheap. Of course, we've seen over and over that this is not what medicine is interested in. How are you enjoying your baby? Do you have any challenges? Comment below. I'll make more videos. Just tell me what you would like. This is Dr. Chris signing off. Ciao mamas. Thank you for watching.